Hello friends, welcome to my presentation. Myself Fajin Shah. Today I am here to present a video on the topic knee complex part 3. In this presentation, we will learn about ligaments of knee joint. In the previous video, we have learned the menisci, knee joint capsule and bursa associated with knee joint. Ligaments of knee joint are collateral ligaments, cruciate ligaments, posterior capsular ligament, meniscofemoral ligament and iliotibial band. First we can see about collateral ligaments. There are two collateral ligaments, medial collateral ligament and lateral collateral ligament. Medial collateral ligament attachment. It gets originated from medial aspect of medial femoral condyle and get inserted into the proximal tibia. Function of MCL. It resists valgus stress force, check lateral rotation of tibia, also restrain anterior displacement of tibia when ACL is absent. Next, lateral collateral ligament attachment. It gets originated from lateral femoral condyle and get inserted into posteriorly to head of fibula. Function of LCL. Resist various stress force across the knee and check combined lateral rotation with posterior displacement of tibia in conjunction with tendon of popliteal muscle. Cruciate ligaments. In Latin, cruciate meaning resembling a cross. Locate within the joint capsule and are therefore called as intracapsular ligaments. Cruciate ligament provides stability in sagittal plane. The ACL and PCL are centrally located within the capsule but lie outside the synovial cavity. There are two cruciate ligaments, anterior cruciate ligament and posterior cruciate ligament. First, anterior cruciate ligament. Attachment. It gets originated from anterior surface of tibia in the intercondylar area just medial to medial meniscus and get inserted to posteriorly on lateral condyle of femur. ACL is divided into two bands, anterior medial band and posterior lateral band. Function of ACL. Primarily check femur from being displaced posteriorly on the tibia. Conversely, the tibia from being displaced anteriorly on femur. It tightens during extension, preventing excessive hyperextension of the knee. ACL carried 87% of load when anterior translatory force was applied to tibia with extended knee. Check tibial medial rotation by twisting around PCL. ACL injury is common when knee is in flux and tibia rotated in either direction. Next, posterior cruciate ligament attachment. It gets originated from posterior tibia in intercondylar area and runs in a superior and anterior direction on medial side of ACL and get inserted into the anterior femur on the medial condyle. PCL is also divided into two bands, anterior medial band and posterior lateral band. Function of PCL. Primarily check femur from being displaced anteriorly on the tibia or tibia from being displaced posteriorly on femur. It tightens during flexion and is injured much less frequently than ACL. PCL carry 93% of load when posterior translatory force was applied to tibia with extended knee. PCL play a role in both restraining and producing rotation of the tibia. This picture shows the collateral ligaments and cruciate ligaments of knee joint. Next we can see about posterior capsular ligaments. Posterior capsular ligaments are oblique popliteal ligament, posterior oblique ligament and arcuate ligament. First, oblique popliteal ligament attachment. It gets originated from the central part of the posterior aspect of the joint capsule and get inserted into the posterior medial tibial condyle. Function. It reinforces posterior medial knee joint capsule obliquely on a lateral to medial diagonal from proximal to distal. Next, posterior oblique ligament attachment. It gets originated near the proximal origin of the MCL and adductor tubercle and get inserted into the posterior medial tibia, posterior capsule and posterior medial aspect of the medial meniscus. Function. It reinforces the posterior medial knee joint capsule obliquely on a medial to lateral diagonal from proximal to distal. Next we can see about arcuate ligaments. It has two branches, lateral branch and medial branch. First, lateral branch. It gets originated from the tendon of the popliteus muscle and the posterior capsule and inserted into the posterior aspect of the head of the fibula. Medial branch. It gets originated from the tendon of the popliteus muscle and the posterior capsule and get inserted into the oblique popliteal ligament on the medial side of the joint. Function. It reinforces the posterior lateral knee joint capsule obliquely on the medial to lateral diagonal from proximal to distal. Next, meniscofemoral ligament. There are two potential portions of meniscofemoral ligament. At least 1 in 91% of knees and 30% knee have both. The meniscofemoral ligaments are not true ligaments because they attach bone to meniscus rather than bone to bone. However, both originate from the posterior horn of the lateral meniscus and inserted on the lateral aspect of the medial femoral condyle, either anterior to the posterior cruciate ligament or posterior to the posterior cruciate ligament. Function. They may assist PCL in restraining posterior tibial translation. Also assist popliteus muscle by checking tibial lateral rotation. Thank you all for listening to my presentation.